I keep a mental list. Every time a patient over 50 explains away a symptom that turns out to be diabetes, I add their excuse to the list. I'm just tired because I'm getting older. I figured I was peeing more because I've been drinking more water. My eyes are fine. I just need new glasses. The tingling in my feet is probably from my shoes. That list is long, and every line on it came from someone who had been living with diabetes for a year or more without knowing, because every symptom felt too ordinary to question. Here's what scares me. While you're busy blaming your age, diabetes is corroding the blood vessels in your eyes, wearing down the nerves in your feet, overloading your kidneys, and thickening your blood in a way that doubles your risk of heart attack and stroke. All of it happening with zero pain and zero warning. Just a handful of symptoms that feel too normal to mention to anyone. Today, I'm showing you 7 of those signs. If even one sounds familiar, stay until the end. Because what you don't know about this disease is exactly how it wins. I'm Dr. Gray. Every week, I break down the silent health risks after 50 in the simplest way possible using real examples and zero medical jargon, so you can protect your health without needing a medical degree. Over 40 million Americans are living with diabetes right now. According to the CDC's 2026 report, nearly 11 million of them have no idea. They haven't been diagnosed. They're walking around with blood sugar levels that are quietly damaging their organs every single day, and they don't feel a thing, because every symptom diabetes produces in its early stages feels exactly like getting older. Among adults over 65, nearly 29% have diabetes. 1 in 3 adults over 18 has prediabetes, blood sugar that's elevated but hasn't crossed the line yet. The vast majority don't know either. Today, I'm walking you through 7 early signs of diabetes that nearly everyone over 50 mistakes for normal aging. By the end, you'll understand why a single blood draw could change the next 20 years of your life. The biggest misconception about diabetes is that it's a lifestyle problem, something that only happens to people who eat badly and don't exercise. Type 2. Diabetes is a plumbing problem, and it can happen to anyone. Your body runs on sugar, glucose, the way a car runs on gasoline. Every time you eat, your digestive system breaks food down into glucose and sends it into your bloodstream. Then, a hormone called insulin acts like a key, unlocking your cells so the glucose can get inside and be used as fuel. In type 2 diabetes, that key stops working properly. The cells stop responding to insulin the way they used to. Imagine a lock that's slowly getting rusty. You can still jiggle the key and get it to turn sometimes, but each year it gets harder. Glucose builds up in the blood because it can't get into the cells efficiently. Your cells are hungry for fuel while the blood is overflowing with it. Over time, that excess sugar starts corroding everything it touches from the inside, your blood vessels, your nerves, your kidneys, your eyes. And the damage happens so slowly that you feel nothing for months or years. What you do feel are 7 things you blame on age. Sign 1. You're exhausted in a way that rest doesn't fix. You slept 7 or 8 hours. You didn't do anything particularly demanding. And by early afternoon, you feel like somebody unplugged you. You sit down for a minute and could easily fall asleep in the chair. After 50, everyone has a reason to be tired, but diabetes fatigue has a specific quality to it. Your cells need glucose for energy. When insulin stops working properly, glucose stays locked out of your cells, circulating in your blood but unable to reach where it's needed. Imagine a car with a full gas tank, but a clogged fuel line. The engine sputters and stalls even though there's plenty of fuel available. That's what your body is doing, surrounded by energy it can't access. If your tiredness doesn't improve with more sleep, better food, or a lighter schedule, if it's been sitting on you for weeks and you can't shake it no matter what you change, your cells might be starving for fuel that your blood is full of. A simple blood draw can tell you whether that's what's happening. Sign 2. You're getting up to pee more often at night. This is the one that overlaps most dangerously with normal aging. After 50, your bladder holds less, your prostate grows, in men, and nighttime trips to the bathroom become part of life. So when you start going twice instead of once or 3 times instead of twice, your brain has an instant explanation ready: age. But when blood sugar runs too high, something different is happening inside. Your kidneys are designed to filter blood and hold on to the useful stuff while flushing out waste. When there's too much sugar in the blood, the kidneys can't reabsorb it all. The excess spills into your urine and it pulls extra water along with it, the same way salt draws moisture out of food. The result is more urine, more often, especially at night when your body is processing the day's intake. If your nighttime bathroom trips have been steadily climbing over the past few months and you've also been unusually thirsty during the day, those two symptoms together are one of the strongest early signals of elevated blood sugar. Sign 3. You're thirstier than you used to be. You're drinking more water than usual, but your mouth still feels dry. You finish a full glass and reach for another 20 minutes later. You keep a bottle by the bed now because you wake up parched. Easy to explain away. I'm probably dehydrated. It's the weather. I had something salty. But excessive thirst is your body's emergency response to losing too much fluid. When your kidneys are dumping extra water to flush out surplus sugar, your blood volume drops. Your brain detects the drop and triggers a thirst signal to replace what's being lost. You drink more, you pee more, you get thirstier, you drink more. And the cycle keeps spinning because the root cause, the excess sugar, is still there. Thirst and frequent urination feed each other. When they show up together and stick around for more than a couple of weeks, that pairing deserves a blood sugar check, not another glass of water. Sign 4. Your vision goes blurry and then clears up again. You're reading a menu and the words swim for a second. You're driving at dusk and the road signs look slightly soft. A week later, everything seems fine again. So you figure your eyes are just aging. Maybe it's time for stronger lenses. But diabetes-related blurriness behaves differently than normal age-related decline. When blood sugar is high, the excess glucose pulls fluid into the lens of your eye. Picture a sponge soaking up water. It swells and changes shape. Your eye lens does the same thing. As it swells, it bends light differently, and your vision drifts temporarily out of focus. When blood sugar drops back down, after a lighter meal or a more active day, the lens releases the fluid, and everything sharpens again. That on and off pattern is what separates this from aging. Normal vision decline is gradual and consistent. If your blurriness comes and goes depending on the day, sugar could be reshaping your lens from the inside. Sign 5. Cuts and bruises are taking longer to heal. You nicked your shin on a coffee table 2 weeks ago, and the scrape is still there. A small cut on your finger that should have closed in a few days is still tender. You bruise more easily than you used to, and the bruises seem to linger. Healing depends on blood flow. Your body sends oxygen, nutrients, and immune cells to a wound through your smallest blood vessels, the capillaries. When blood sugar runs high for extended periods, it damages those tiny vessels from the inside, making them narrower and less efficient. The repair crew still shows up, but it has to travel through damaged roads to get there, slower, with fewer supplies. On top of that, high blood sugar weakens your white blood cells, the soldiers your immune system sends to fight infection. So, wounds heal slower and are more vulnerable to getting infected along the way. But I'm not done yet. Age-related slow healing happens gradually over years. If things that used to close in a week are now taking 3, and that shift happened over the past several months rather than the past several decades, that acceleration is worth investigating with a blood test. Sign 6. Your hands or feet tingle, burn, or go numb. You're lying in bed and your toes feel like they're buzzing. You wake up and the soles of your feet feel strange against the floor, like there's a thin layer between your skin and the surface. Your fingertips tingle when you grip a coffee mug. High blood sugar damages the smallest blood vessels first, and those tiny vessels feed the nerves at the furthest points from your heart, your feet and hands. When those nerves lose their supply line, they start sending garbled signals. Tingling, burning, numbness, a strange buzzing that comes and goes without any reason you can identify. Roughly half of all people with diabetes develop some degree of nerve damage over time. But what catches people off guard is that this damage can begin during the prediabetes stage before anyone has officially told you anything is wrong. Your nerves respond to the sugar level in your blood, not to the diagnosis on your chart. If that level has been creeping up for a year or two, the fraying may already be underway. Sign 7. You're losing weight without trying. This sounds backwards. Everyone associates diabetes with weight gain, but unexplained weight loss can actually be one of the earliest signals, especially when the body's insulin system is seriously struggling. The logic is straightforward. If your cells can't access glucose because insulin has stopped doing its job, your body needs energy from somewhere else. So it starts breaking down fat and muscle to keep the engine running. You're eating the same as always, maybe even more, but the scale keeps dropping because your body is burning its own reserves to compensate for the fuel it can't pull from food. 5 to 10 pounds over a couple of months with no change in diet or exercise is worth bringing up with your doctor. Unexpected weight loss feels like a bonus when you don't understand the cause, but when your body is consuming itself for energy because it can't use the sugar in your blood, that's not a bonus. That's an alarm. Here's your prescription. This week, ask your doctor for a fasting blood sugar test and an HbA1c test. The fasting test measures your blood sugar right now. The HbA1c measures how much sugar has been sticking to your red blood cells over the past 3 months. It's like checking the walls of a pipe to see how much buildup has been accumulating. Normal HbA1c is below 5.7%. Between 5.7 and 6.4 means prediabetes. Above 6.5 means diabetes. One blood draw gives you both numbers. If you're over 45 and you haven't been tested in the past 3 years, you're overdue. If you have a family history of diabetes, if you're carrying extra weight around the midsection, or if you recognized yourself in more than 2 of the signs I just described, get tested this month. And here's the part that changes everything. Prediabetes is reversible. Patients who cut back on sugar and processed food, walk 30 minutes a day, and lose even 5 to 7% of their body weight can bring their numbers back to normal, often without medication. But you can only reverse something you know about. And you can only know about it if you test for it. Raymond, a patient of mine, 64, added 5 lines to that list I mentioned at the start. 5 symptoms, 5 perfectly reasonable explanations, and behind every one of them, diabetes was quietly running up a tab that his body would eventually have to pay. We caught it late, but we caught it. He's on medication now. He changed his diet, he walks every morning, and his blood sugar is under control. His kidneys stabilized, his nerve damage hasn't progressed, he still has his eyesight. But he carries something with him that medication can't touch. He told me, "I spent 3 years thinking I was just getting old. Every symptom on your list, I had it. And I explained away every single one because nobody ever told me what they actually meant." That's 11 million people right now in this country, living with diabetes they don't know about, feeling the symptoms every day and filing them under aging because the connection was never made for them. Your body doesn't change after 50 for no reason. When the fatigue gets heavier, the thirst gets stronger, the healing gets slower, the vision comes and goes. Something specific is driving it. The least you can do is find out what. 1 blood draw, 1 morning. That's the whole difference. Now you know. The rest is on you.